chair. Where is he? I'm told that one chair has gone to wash. So good morning once again, and welcome to the last plenary session of our Advocacy. I'm sure so far you found the conference very useful, and I'm sure that most of you are meeting the objectives for which I came to kick out. It is my pleasure to start this session, and for this morning session, we're going to have 3 chairpersons and then 3 speakers. It's my pleasure to introduce the first chairperson, and she is Mrs. Samakwara. Mrs. Samakwara is currently the Executive Secretary of the Rwanda Network of People with HIV. This is a civil society organization which is an umbrella association of people affected by HIV. She leads 800 associations, delivering community support through more than 5,000 HIV educators to over 120,000 persons living with HIV. This is being done in collaboration with our 523 health facilities in the country. SAG is very passionate about community advocacy and has more than 8 years experience in the Rwanda health sector, mainly in HIV community support, HIV mainstreaming in the workplace, and in health promotion. SAG obtained her MBA degree from Oklahoma Christian University in the United States. She has undertaken numerous trainings in HIV community support, human resource management, and in procurement.
Good morning, bonjour. I would like to introduce the first speaker for this session, Ms. Wame Jallo, Director of the Global and Advocacy at ITPC, based in Botswana. She currently manages all the ITPC's programmatic and program and strategy pillars, such as treat people right, watch what matters, make medicines affordable across global regions in Latin America and Caribbean, East Europe and Central Asia, Middle East and North Africa, East Africa, Middle East and North Africa, and Asia. Ms. Jallo has worked within the civil society and development partner sectors for the over 18 years and has a wide range of expertise, includes resource mobilization, policy development, advocacy, community dialogue, community and health system strengthening, costing analysis, and developing innovative practice that engage non-conventional partners in HIV response. Please help us to welcome Ms. Jallo. Good morning, everyone. It's a real pleasure and honor to be here this morning, and bring greetings on behalf of the ITPC team. My presentation this morning is around community-led monitoring and how it serves a purpose to ensure that we can improve quality of service delivery. Next slide, please. So where are we today? We've been hearing a lot over the last week about where we are with HIV-response. And I'm not going to repeat because we've had a lot of excellent speakers, but it's really to stress the point that we still have a long way to go in terms of reaching our targets. There's still a huge gap in terms of treatment access. And I'm going to narrate over the next few minutes what we're seeing from the community perspective and some of the system treatment access issues that still exist. Next slide. Community-led monitoring is a way, it's a mechanism that we have tried to develop to really bring community voice to the table. And this is a systematic process that allows for communities to collect data along the HIV/AIDS cascade to demonstrate from the community perspective where the gaps still exist. We use these three pillars, prevention, treatment care, and file suppression, to ask the critical questions. What is still going wrong? Why are we still having some of the treatment access gaps that we're experiencing on the ground? Next slide, please. And to do that, we've set up a model that allows for data collection to start from community and healthcare facility level with data collection. So data collectors, community data collectors working on facilities, collect data on a monthly or quarterly basis, are able to then analyze that data and then articulate some of the issues that we're seeing on the ground. And this is 100% led by the community, and it's really important to have the community voice do this in order to be able to see from the community perspective where are we still getting things wrong. Next slide. We use a 5 A's model in order to unpack what we're seeing are some of the treatment access gaps, looking at issues of availability. So do the required health services, medicines, and commodities still exist? We're hearing a lot about drug stockouts in many of the regions around the world. If so, do they exist? Do they exist when they are needed in adequate supply? We look at issues of accessibility. In other words, how far has a recipient of care traveled to get access to health services? In many instances, we're still hearing that people are traveling 20, 30, 40 kilometers away from their homes to get access to services. The acceptability of the service delivery. Is the standard of care high quality? Are we getting optimal medicines that we require? Are the medicines affordable? Affordability in many of our countries is still a sticking point. There are many patents and barriers that are still creating lack of access to affordable and optimal medicines, and the appropriateness of the services. And this is really linked to our strategies around how we're providing services for key populations. Next slide. So I'm going to give some examples of, from the ITPC perspective, how we've been able to unpack some of the issues and advocate for change in our environments. This is an example of the Community Treatment Observatory that we implemented in West Africa over the last 3 years. And the partners were quite expensive across 11 countries, working with networks of HIV. Next slide. This is the power of the data from the Community Treatment Observatory work. We worked across 11 countries during 2 years of data collection, and we worked in 125 healthcare facilities. Those healthcare facilities were servicing about 106,000 people on ART, and we undertook numerous amounts of qualitative and quantitative research methods, doing interviews and focus group discussions, and also having one-to-one key moment interviews with healthcare providers. Next slide. And what did it show us? It showed that we still had a long way to go. There is still persistent stockouts, not only for medicines, but also lab reagents, and the length of time of the stockouts was actually quite extensive. And over time, we were able to advocate to demonstrate that these stockouts, the impact of these stockouts on the recipient care perspective, and to advocate for change in that. The second bottom of the slide was really looking at issues around quality of care, increased uptake, not only of viral tests, but turnaround time to receive the tests, and also making sure that at the end of the day, viral suppression had actually been achieved. And over time, as you can see, over the 3 years, we were able to systematically improve quality of care, number of tests, viral tests actually done, but also the time in which the results were provided to the recipient of care within 2 weeks. Next slide. We undertook a global survey in 2019, and this was to really corroborate what we're seeing, not only just in West Africa, but across the world. What are some of the treatment access gaps that we're still experiencing today, to explain some of the huge treatment gaps that we're seeing in the data. We did this study among 2,777 people living in 14 low-income countries around the world. Next slide. And the results were as follows. Stigma is still a huge barrier, not only to the general population, but especially for key populations. 2/3 of the respondents, which is 64.6%, had experienced an episode of anticipated stigma in the previous 12 months, in other words, from 2018 to 2019. Next slide, please. We also looked at issues around diagnosis as well. And what we saw is that we're still having late presentation rates across countries and region, and these were unacceptably very high. Of our sample size, there were 37.1% of the survey respondents who were diagnosed with advanced HIV. And even though there was an improvement from 2015 when the treatment guidelines changed, we're still seeing that the late diagnosis is still quite a huge issue. Next slide. In terms of viral load monitoring, not only were in many countries viral load tests not being actually done, we were seeing quite a lot of gaps in terms of when the timely feedback of those results to inform ART management for the recipient care be more than 6 months. So overall, only 47.6% of the survey respondents have actually reported that they had a viral test after 6 months of being initiated on ART. And up to 14.4% of the survey respondents did not know the result of their most recent viral tests. Only 53.3% of people in our sample size had viral suppression were informed that their viral load was actually undetectable. Next slide. We recently undertook another survey in 2 countries in Eastern Europe and Central Asia among people who inject drugs in Kyrgyzstan and Pakistan. And similarly, we saw the same results. Issues around HIV/AIDS exposure was still quite a challenge out of fear of physical abuse or being forced out of home or discriminatory behavior. Next slide. Linkage to care, again, a great challenge. In Kyrgyzstan, for example, amongst the 321 people who inject drugs surveyed, the median period between receiving an HIV diagnosis and ART initiation was 55 days amongst people who inject drugs, versus 10 days for people who do not, people living with HIV who don't inject drugs. So as you can see from that, there's still a lot of issues around who is actually getting access to services and the timeliness of that scale up. Next slide, please. So the statistics is just a way of bringing issues to the table to say we still have a long way to go. From the community perspective, we've been able to really tease out this is what we're seeing from our perspective. And this is quite critical because it allows for communities to have a voice and bring the issues to the table in a very concrete way. But how do we do that? Next slide. We can only do that if we empower communities in order to be able to drive that change. The first part of it is trying to promote demand generation. And to do that, we need to focus on facilitating treatment education across communities. empowering the recipient of care communities to understand science, to understand treatment guidelines, and be able to express from our point of view what we're seeing as key challenges in treatment access. And then systematically empowering communities to collect data at healthcare facilities, but also at community level to provide evidence of some of the issues that we're identifying, and engage with national AIDS program, engage with government stakeholders, engage with health facilities to facilitate that change from an evidence point of view. With that, thank you very much, everyone. Thank you very much, Mr. Distinguished guests, allow me to introduce the second chair of this session, Julian Kerboghossian. Julian Kerboghossian is 28 years old, youth activist from Lebanon, MENA region. Julian is the vice chair at the Global Network of People Living with HIV. He is also founder of SIBA, MENA Youth Network on Sexual Reproductive Health and Rights, and HIV/AIDS. He is also the board member of Impact Global. Please welcome Julian Kerboghossian.
Good morning, everyone.
Good morning.
So now we have a young speaker. Exciting.
Yes.
First, allow me to thank Mikasa for bringing us all here. And allow me to thank Her Excellency, Senator Diop of the African Union, for reaching out to young people and for hearing our voices and acting. We are 2 days ahead of the International Day for Volunteers. So first, please, a big applause for all the young volunteers globally. I want an applause for volunteers. Thank you. So, I would like to introduce our speaker, which was a great honor. Goel Fatilato, statistical engineer and monitoring and evaluation manager, born on 7/1/1993, with a congenital malformation, is a disabled girl from a housewife mother and a businessman father. Passionate about social issues, she embarked on an associated life with Association des élèves et des étudiants africains au Burkina, which she left in 2019 to found the association Vive. She is also a member of Pan-African Female Youth Leaders Burkina Faso and the Flame of Hope Association for Youth Emergence.
Bonjour tout le monde.
Bonjour.
Je vais ce matin communiquer sur comment éliminer le VIH avec l'insertion des cheveux. Je vais commencer par vous présenter quelques données. J'appuie sur ça, s'il vous plaît. Alors, en 2018, dans le monde, il existait 1,6 million d'adolescents séropositifs. Le sida est aussi la première cause de décès des jeunes en Afrique et la deuxième dans le monde. Il faut ajouter que le manque d'information des jeunes sur le VIH fait en sorte qu'il est un obstacle du moins pour la réduction de l'infection du VIH chez les jeunes. J'appuie sur votre s'il vous plaît. Alors, en termes de connaissance du VIH chez les jeunes, une étude effectuée en 2017 a montré que, comparativement à il y a 10 ans, il y a une amélioration. Mais cette amélioration demeure très faible parce que le nombre de jeunes informés sur le VIH ne vaut pas la moitié de l'ensemble des jeunes de l'Afrique. Diapo suivante, s'il vous plaît. À travers cette cartographie, nous pouvons voir que dans les pays pauvres de l'Afrique, il existe les mariages précoces des enfants, il existe les rapports sexuels intergénérationnels, il existe les rapports sexuels transactionnels, aussi le taux d'activité sexuelle chez les jeunes est élevé avec un taux faible d'utilisation des préservatifs. Notons aussi que dans ces pays, les filles enceintes subissent une stigmatisation. Alors, à travers ce graphique, nous pouvons voir qu'en termes de situation des 3,90 chez les jeunes de plus de 15 ans en Afrique de l'Ouest et en Afrique centrale, il reste beaucoup de choses à faire. Diapo suivante, s'il vous plaît. Diapo suivante. Voilà. Maintenant, en termes de défis que rencontrent les jeunes, notons que les parents dont les enfants sont séropositifs n'informent pas leurs enfants qu'ils sont infectés par le VIH. Alors que s'ils le faisaient et que les enfants prenaient leur traitement, la charge virale pourrait être supprimée à temps. Ces enfants, lorsqu'ils découvrent qu'ils sont séropositifs, ils sont choqués, ils sont stigmatisés et ils peuvent aller même jusqu'à se suicider. Notons également que dans nos sociétés, la sexualité demeure toujours un tabou. Aussi, il y a le fait que les gouvernants de l'Afrique du Nord et de l'Afrique, excusez-moi, de l'Afrique du Centre et de l'Afrique de l'Ouest, se sont engagés pour l'éducation sexuelle à la complète. L'éducation sexuelle complète, ils l'ont votée, mais ils peinent à la mettre en place. Cela aussi est un défi que rencontrent les jeunes. Diapo suivante, s'il vous plaît. Là, je vais vous présenter quelques témoignages de jeunes sur le VIH. Des témoignages qui montrent que les jeunes sont un vecteur de changement et les jeunes aussi, à travers leur leadership, peuvent contribuer à lutter contre la stigmatisation dont sont victimes les personnes vivant avec le VIH. Là, je vais vous lire quelques exemples. Par exemple, on a ce jeune de 20 ans qui dit « La jeunesse est l'avenir et c'est nous les jeunes qui deviendrons les adultes de demain. » Nous avons donc le pouvoir de supprimer la stigmatisation dont sont victimes les personnes vivant avec le VIH. Il y a un autre qui dit « La non-stigmatisation des personnes vivant avec le VIH par les jeunes pourra changer la perception d'une société entière sur le VIH et pour cela, il faut que les jeunes soient sensibilisés. » Cela montre que pour que les jeunes arrivent à contribuer à lutter contre la stigmatisation, il est essentiel que les jeunes aient l'information nécessaire sur le VIH. Diapo suivante, s'il vous plaît. Maintenant, je vais vous présenter quelques exemples de leadership de jeunes qui montrent que les jeunes, en plus d'être vecteurs de changement, ont besoin d'être impliqués au cœur même des prises de décision. Par exemple, on a Afrian, qui est un réseau africain de jeunes et d'adolescents qui œuvrent dans le développement et dans la santé pour l'implication des jeunes au sein des prises de décision. Il y a également Ready Movement, qui est un mouvement organisé par des jeunes pour la résilience des jeunes vivant avec le VIH et pour leur autonomisation. Ajoutons Nyanki World Today, qui est aussi une organisation de jeunes qui fait la promotion de l'éducation sexuelle à la femme. L'éducation complète sexuelle. Diapo suivante, s'il vous plaît. Alors, ajoutons la consultation régionale des jeunes de l'Afrique du Nord et du Moyen-Orient, qui est une consultation qui a contribué à la formation du SIBA. Et enfin, il y a le MANJ, le mouvement d'action des jeunes du Burkina Faso, un mouvement national qui œuvre pour l'accessibilité des jeunes aux services de santé sexuelle et reproductive à travers des plaidoyers et des sensibilisations. Diapo suivante, s'il vous plaît. Maintenant, je vais vous présenter les avantages qu'a l'éducation sexuelle à la complète. J'ai du mal à dire cette phrase. J'ai en tête le terme en anglais, même si je suis francophone. L'éducation complète sexuelle. Alors, en termes d'avantages, notons que cette éducation permet de réduire les infections sexuellement transmissibles, la transmission du VIH, les violences basées sur le genre, ainsi que les grossesses non désirées. Mais ce n'est pas tout. Diapo suivante, s'il vous plaît. Alors, elle permet également aux jeunes de rester en bonne santé. Tout le monde, ce que nous voulons, c'est être en bonne santé. À travers l'éducation sexuelle complète, les jeunes seront en bonne santé. Les jeunes pourront poursuivre leurs études, pourront poursuivre leurs projets personnels à cause du fait que l'éducation complète sexuelle leur permet d'éviter les conséquences liées aux grossesses non désirées, aux grossesses précoces et aux violences basées sur le genre. Également, notons que l'éducation complète sexuelle renforce l'autonomisation des jeunes, renforce leur capacité à prendre des décisions, renforce leur confiance en eux-mêmes et également leur permet d'avoir l'esprit critique, chose importante pour un leadership. Diapo suivante, s'il vous plaît. Pour terminer, en termes d'avantages que l'éducation complète sexuelle a, il y a aussi le fait que ça octroie plus d'informations aux jeunes. On a vu que les jeunes manquent d'informations sur la sexualité, les jeunes manquent d'informations sur le VIH et l'éducation complète sexuelle permet aux jeunes d'avoir au maximum d'informations possibles sur ce thème. Ça leur permet également d'adopter des comportements positifs, tout comme ça leur permet d'avoir une grande capacité d'utilisation des préservatifs et des contraceptions. On a vu que l'éducation complète à la sexualité a beaucoup d'avantages qui peuvent essentiels pour éliminer le VIH. Cela voudrait dire que l'éducation complète sexuelle est important, que les jeunes ont besoin d'avoir d'informations sur la sexualité. Et quand je dis jeunes, c'est y compris les jeunes en situation de handicap. Alors maintenant, je vais un peu exposer la situation des jeunes handicapés par rapport au VIH. Et je ne pourrais faire cette exposition sans me présenter d'abord puisque je suis en situation de handicap. Disons que je suis une jeune qui est handicapée et doublement amputée. Mon handicap, même si la base est due à une malformation congénitale, en 2013, quand j'avais 20 ans, j'ai subi une amputation des deux jambes. Alors, en termes de handicap, du fait que je suis handicapée, j'ai rencontré des obstacles pour avoir accès à l'information sur la sexualité. Et ces obstacles sont surtout liés au rejet de la société et également à l'ignorance de la société qui pense que la jeune personne handicapée n'a pas de sexualité, donc n'a pas besoin d'informations sur la sexualité. Chose qui n'est pas vraie. Dans nos sociétés, il est difficile d'aborder le sujet de sexualité avec les jeunes. En ce sens, il est encore plus difficile d'aborder le sujet quand il s'agit d'un jeune en situation de handicap. Surtout que la société pense que ces jeunes n'ont pas de sexualité, donc n'ont pas besoin d'informations sur la sexualité. Chose qui n'est pas réelle. Les jeunes en situation de handicap sont des jeunes comme tous les autres. Ils ont juste une limitation fonctionnelle. Sinon, ils ont les mêmes droits, les mêmes besoins, les mêmes envies, la même sexualité. À cela, donc, ils ont besoin également d'avoir des informations sur la sexualité afin de mieux gérer leur sexualité, afin d'être en bonne santé. Diapo suivante, s'il vous plaît. Les jeunes en situation de handicap rencontrent des difficultés pour avoir l'information. Et ces difficultés sont liées surtout au fait que les campagnes de sensibilisation ne sont pas adaptées à tout le monde. Voyez-vous, le jeune en situation de handicap visuel, celui en situation de handicap auditif, le jeune en situation de handicap moteur comme moi, et le jeune qui n'a pas de handicap n'ont pas les mêmes besoins pour capter l'information. Alors qu'habituellement, la manière de passer une information est basée uniquement sur le jeune qui n'a pas de handicap. Cela fait que le jeune qui a un handicap visuel ou le jeune qui a un handicap auditif, qui a un besoin spécifique pour capter l'information, est mis à l'écart. Cela fait que les jeunes en situation de handicap ont des difficultés pour avoir accès à l'information sur la sexualité, quand bien même que c'est nécessaire. Ajoutons que les femmes en situation de handicap subissent une violence sexuelle. De ce fait, elles sont très exposées au VIH. Alors un point important qui montre que les femmes en situation de handicap ont besoin d'informations sur la sexualité, ont besoin de connaître leurs droits pour se défendre face à la violence sexuelle qu'elles subissent. J'apporte souvent, s'il vous plaît. Alors, je suis à la fin de ma communication. Le point essentiel que je voudrais souligner est que le fait que je sois handicapée, doublement amputée, fait aucun cas de moi une vie différente des autres. Au contraire, j'aime très bien le souligner. C'est juste que la vie n'est pas facile, certes. Et quand il s'agit de personnes en situation de handicap, elle est encore plus difficile parce que nous avons des besoins spécifiques. Et vu que la société inclusive nous rejette, cela fait que nous battons 2 fois plus pour nous faire accepter, pour faire considérer nos droits, pour avoir accès à l'information sur la sexualité, pour réduire l'infection du VIH au sein des jeunes en situation de handicap, au sein des femmes handicapées qui subissent une violence sexuelle. Et pour terminer, je voudrais inviter à chacun à penser à inclure les jeunes en situation de handicap dans toutes les initiatives qui visent à renforcer le leadership des jeunes. Je vous remercie.
Thank you for the presentation. Now I would like to introduce the third chair of our session today, Kemi Gbadamosi. Sorry for the spelling, it was wrong. Is a lawyer, communications PR professional, policy advocacy strategist, and the leadership coach. Her advocacy and policy work focuses keenly on the HIV/AIDS, women and girls' rights, and access to education for young women and girls. Kemi works as the senior manager, PR and communications, Africa, and the regional policy and advocacy manager for Mozambique, Nigeria, Zambia, and Zimbabwe at the AIDS Healthcare Foundation. AIDS Healthcare Foundation is the largest independent provider of free HIV/AIDS services in the world, serving more than 1 million individuals across 43 countries, 13 of them are in Africa. At the AIDS Care Foundation, she is a co-initiator of the organization's Girls Activities in Africa, which has reached out to more than 30,000 girls and expanded to AHS programs in Haiti and Greece. Our speaker works closely with women and girls within and outside the development sector and sits on the board of youth organizations such as Stand to End HIV. She is an internationally certified speaker, coach, and trainer with the John Maxwell team and Advocacy. Please welcome our chair.
Thank you very much, Julian. And good morning once again. I think I'd like us to give another round of applause. As someone who is very passionate about young women's health and the issues that affect them, the next speaker who comes up on a very particular area that, regardless of what we do with health, access to treatment, if we do not address the social constraints that young women and girls face, we would not get anywhere. And if there's anything we have heard over the past couple of days, it is the fact that while access to health is good, but for a young woman or a girl to get access to health care, there are many other hurdles that they need to jump. For example, gender inequality. And we look at the issues of gender-based violence, we look at issues of unfavorable policies, traditions and customs that continue to subjugate young women and girls and even women in general. We look at even religion. Some of those things have made it very, very impossible for girls to have agency, for girls to amplify their voices, and for girls to be part of the decisions that affect their lives. And when we look at some of the social constraints, we cannot all but agree that a lot of them are fundamentally unjust. And if they are not addressed, there's only so little that we will be able to achieve as a people. And that also includes ending the spate of new HIV infections among children. So I remember a young girl called Shili, who lives in a very small shack with her father and brother. She's HIV positive. But it's just a tiny room that she can barely have space to move in. And she lives in an environment that is fraught with gender-based violence, from rape to crime. And at the same time, she struggles to stay in school because her father, who is a car pusher in the market, cannot afford to pay for school fees. But she has access to treatment. But how far will that go if the other factors surrounding she are not addressed? She continues to be vulnerable. And so our next speaker is someone who is very cognizant with addressing social issues and social constraints when it comes to young women and girls and creating access for them, and also giving them an agency to use their voice. Sandrine Umutoni is the Director General of the Mworeko Foundation. She is passionate about Rwanda, social studies, the arts, and discovering new culture. In 2015, she began her work at the Mworeko Foundation, an organization that aligns its work to the country's priorities by contributing to the development of a healthy, educated, and prosperous society. Starting from the communications unit, Ms. Umutoni was later appointed in 2016 as the Foundation Director General. Before joining the Mworeko Foundation, she worked in education for various institutions on research and promoted access to literature and the arts for diverse members of the community. Ms. Umutoni pursued her education in international relations, communications, and translation on 3 continents. She also is very creative at heart. She published her first children's book in the year 2016. Ladies and gentlemen, please join me in welcoming Sandrine Umutoni.
Good morning, everyone.
Good morning.
Thank you, Kemi, for this very nice introduction. As Kemi just mentioned, the purpose of my presentation today is to focus on the specific social structures that still hinder the empowerment of girls and young women in our communities. And before I start, I just want to highlight some of the conversations I've been listening to since I've joined the conference. And some of the comments that were coming back is that we've been forgetting the men and only empowering the women. And what I found that comments to be a bit controversial, what I would like to highlight today is that our women and young girls are still left behind. We have not reached that level yet where men are left behind the same way girls are for the women. So as I begin, I want to highlight that the young girls and the young women in our community are really victims to some health deficiency or health issues that do not affect the men the same way. So what we notice in Africa is that the women account for more than half of deaths worldwide due to communicable diseases, maternal and perinatal conditions, and nutritional deficiencies. In addition to that, we see that women are actually made heavy or the victim of a heavy burden of HIV and AIDS in the community. And the more we dig into the reasons why women tend to be more victims to some social structures around them, we realize that they have limited access to resources, and in other situations, they also have limited control over those resources. We also notice that when it comes to decision-making power in the family and in the community at large, they also tend to be at disadvantaged position. So that is for that reason that we actually believe at the foundation that we need to invest in women and girls in order to create a long-term social and economic benefits for communities at large, but also contribute to demographic dividends. And I want to end my grand introduction by saying that health is a basic human right, and women should have the same claim to reach just as the men. So as I begin now, I get into the core of the presentation, I want to give a bit more background on the foundation I work for. So Mworeko Foundation was started 18 years ago by Her Excellency the First Lady of Rwanda, Mrs. Janet Kagame. When the First Lady launched the foundation, it was in 2001, and I would say the socioeconomic situation of the country was not what it is today. At the time, we were dealing with a heightened crisis of HIV/AIDS that was affecting women disproportionately. So when the First Lady launched the foundation, she actually started with a program that was looking at PNTCT, again, because we were coming out just a few years after the genocide against Tutsi, where women had been purposely raped and infected with the HIV virus. So as I take you back into the historical context of this foundation, I want to basically give you a bigger perspective of where we are today. And as we progressively evolve through the years from a one single project in PNTCT to today the implementation of over 20 programs in health education and economic empowerment of women and youth, what we really strive to do is to create services that look at the entire life cycle of the family. And today the purpose of this presentation is really to show how we can focus on one specific demographic group, because that group has a larger impact on the community. So as we went into these activities of supporting the young girls and young women in our communities, we actually noticed that there were some barriers to their empowerment. Some of the barriers that we noticed were insufficiency of inclusive programs, there were not sufficient platforms or expressions to be able to hear some of the challenges that they had. And as Mworeko panelists just explained a few minutes earlier, there are other challenges that we need to sit down and think about that may not have seemed as obvious to other people. But in addition to that, we also wanted to make sure that we could provide youth and gender-friendly services so that our young people could be welcomed in the different facilities where they will be going to seek services. And last but not least, we still also notice on the continent, and more specifically in sub-Saharan Africa, that there's still violence towards girls and women, and we also harmful practices that are rooted in cultural beliefs that we also strive to deconstruct and get rid of. Next slide, please. So as we work in the community, we actually believe that for any initiative to be as impactful as possible, we need to be able to work hand in hand with the community, not only consider them as beneficiaries, but actually see them as partners who ensure that the sustainability of the activity that we bring in will be able to continue even long after the foundation has moved to another community. So we believe that we can empower these communities through mobilization, access to life-changing knowledge, but also adequate services. So in terms of the foundation, what we do is specifically looking at the agency of young girls and young people in general. We put together adolescent sexual reproductive health programs where we actually encourage a positive mindset change, because we really believe that that's where everything starts, but also work hard to deconstruct stereotypes around bodily integrity and gender roles, because again, we believe that people are not born immediately to subdue motherhood. They are born with a clean slate, but then this culture actually adds different behaviors and attitudes, and that dictate how the person is going to treat the person who's in front of them. So at the Mworeko Foundation, what we do is we go closer to the community, and we actually interact with them as holistically as possible to be able to understand what causes some of the imbalances that we notice around us. Next slide. And as we work with the community, we also believe and we see that the parents and the guardians are the ones who have the most influence over the children or the adolescents and children. And that is for that reason that we believe that parents can actually model positive behaviors and lifestyle for their children to emulate. So it is important that as we focus on the adolescent and young people generation, that we do not forget the parents and we also empower them with the right information. And as you can imagine, if you're a parent and you have a teenage daughter or a teenage son, it's not as easily that you want to sit down and hear them tell you about how they're attracted, they have a crush on someone, that they have feelings for somebody of the opposite sex or the same sex. And again, because of our cultural beliefs, we still tend to believe that everything that is related to sexuality is a taboo. So what we try to do is actually desexualize comprehensive sexual education. We try to desexualize as much as possible ASRH and try to bring it back to something as simple. This is about health first and foremost. And because it is an issue related to public health, people deserve to have this kind of information. Of course, this is something that takes time. We need to be in the community over an extended period of time. We need to engage the parents in what we call parent and adolescent communication forums, so we can progressively break these barriers that were hurting the communication within the home. And in addition to that, we also believe that by working closer with the family, we can also empower the parents to give the strategies that can be useful for the adolescents and youth living in the family to be able to avoid these unhealthy attitudes and behaviors when it comes to sex or relationship with people, but also understand that if they are victims of sexual or gender-based violence, that they understand that it is their right to go and seek services and seek support because a crime has been committed. Next slide, please. And as we actually continue to evolve within the different initiatives that we have, we also believe that strong political will also has to go hand in hand with the activities going on in the community. We believe that there is also need for effective partnerships. And by that, what I mean is, if we do not have the strong political will at the beginning, what we do will be pointless, because we will not have the strong machinery, which is the government, also helping push behind us, members of the civil society, the efforts we try to bring into the community to see positive change. So we believe that various social and economic factors that impact the health of populations do deserve a more holistic approach, so that the policies and actions beyond the mandate of the health sector can also be addressed, so we can actually bring an end to the gender inequality and inequity. And when it comes to effective partnership, as I gave my presentation, I was mentioning that the community to us are partners, they're not just beneficiaries of our initiative. But we also believe that to be able to have the sustainability of these initiatives, we need to make sure that all of the stakeholders can be brought together around the same table and have the same conversation and be able to design innovations together. So for us, of course, we work with the government of Rwanda, we work with development partners, but we also understand that the private sector also has a role to play in the initiative that we have, of course, the civil society. And last but not least, we try as much as possible to also involve the faith-based institutions within our communities, because we understand that they are also an integral part of the life of the community. And again, if you do want to have a lasting impact, you need to be able to make sure that everybody who has a voice in the community can be brought and help you amplify the message that you want to bring forward. Next slide, please. As I just mentioned, the importance of the community involvement and the strong political will and effective partnership, there is also a need for a legal framework. As we know, in many of our countries and communities, we notice that women do not always have this access to legal representation, or actually the law does not always provide, I would say, policies or access to certain, like what I would call basic rights. So when we notice that there is still some power imbalances and no representation of women in decision making, we realize that consequently the voices of young women and girls are so harder to hear. So we have to ensure that the laws and implementation of these laws do not discriminate against girls and women, but also that they're considered as measures that can significantly improve the gender equality and health equity. So that is the reason why we do need to have intervention at the structural level, where governments have a central role to play in both the policy and legislation, and in mandating organizational change. And last but not least, we need to be able to have the establishment of societal freedom from discrimination and violence, as those are needed to increase girls' and women's access to economic resources and social inclusion. As I'm coming close to the end of my presentation, before we show the video, I just want to come back again on the importance of empowering our young girls and women in the communities. They are powerful agents of change. When you think of the life cycle again, the young girl is naturally or encouraged actually to care for the other members of the community, members of the family. So it's not rare to actually see a sister caring for a younger sibling. It's not rare to see a wife caring for the family of her husband as well. So if we do believe that within our young women and girls, there's this tendency that's being cautious to actually care for those who are around them and impact their lives positively, we owe it to them to actually give them all the tools that they need, not just focus on what benefits us at the moment. So as we believe that the girls and the young women are powerful agents of change, we also need to understand by not empowering them fully, who actually hurt our development and all of us together. So as we need to equip them with the knowledge, capacities, the skills, and ethical values to fulfill the different roles they've been called to fulfill as they grow up. Again, I want to come back here on some of the work that we do at the Foundation, where we try as much as possible to promote positive behavior and leadership within our young girls. And I just want, before I go into the video, I want to highlight some of the examples of initiatives that we do at the Foundation. So first of all, when it comes to sexual and reproductive health, in the different districts that we work in, we also believe that through a peer education model, we're able to actually have a bigger impact because we've all been teenagers, we know how easy it is for us to actually communicate with someone who's own age. And for us, we see it as actually an entry point to be able to say, if young people still have some resistance or not feeling as easily comfortable talking about sexuality with the parents or teachers, then let's find another model that can also help complement the challenge that we're experiencing at the moment. So we do have a peer education approach that's being brought into the different initiatives of the Foundation when it comes to health. In addition to that, we also do believe in the importance of mentorship. So through our mentorship program, we actually work with young adults, both men and women, and pair them with industry leaders who are able to guide them in their life. So the kind of guidance that they give them is social, it's professional, and again, because we realize that there has been a gap in our history. As you're all aware, the history of Rwanda has led to over 1 million people, killed during the genocide against the Tutsi. And the beneficiaries, the primary beneficiaries of this mentorship program that I'm talking about right now, are actually young survivors of the genocide. So as they have been raped of some of the family members, we found that what we take for granted in some situations, being able to go speak to someone who's older than you and ask for guidance or information, we find that this mentorship program has been able to actually come closer to this very specific demographic of young people, young women, to provide the kind of mentorship. And this mentorship really covers different aspects of their lives, from education to social needs to professional development as well. The other element I would like to speak about today is the celebration of young Rwandan achievers. This is an activity where the First Lady of Rwanda actually rewards young innovators in the community. And today we have seen young women actually go beyond what the community could have expected of them. The reason we do that in terms of empowering our young women is that we believe that they are capable of finding a solution to most of the most pressing challenges we have in our communities. And by empowering them and actually putting the accomplishments on the platform, what we are actually doing is inspiring also other young people to follow in the footsteps and really realize that there's no limit to how much young women can achieve. And the last element that I will speak about today, can we go back to the previous slide, please? Thank you. The last element is the promotion of girls' education. This is also done through a campaign where Excellency the First Lady travels to the different districts of the country every single year and reward the best performing girls. And by best performing girls, I mean over 6,000 girls awarded to date because they have been able to get the best marks at national exams. So as you can imagine, when you have the person to come to the community, reward your daughter, I'm pretty sure the next year you will make sure that you give that daughter the space that she needs to be able to perform even better in school. As a member of the community, you also develop this competitive attitude where you also want your daughter to also do well the next year, so she can also be, receive this kind of recognition from the highest level of our government. And as getting close to the time that was allocated to me. If you can now go to the video, it is a video that we entitled Faces of Strong Women. Those are young women that have gone through some of the programs of the Mworeko Foundation and really today exemplifying the leadership that can be born out of young women when you give them all the right tools, the right knowledge, and the access to the right services for them to really thrive. If you can please play the video now.
Rwanda has put in place the necessary structures for women to achieve their full potential. My name is Esther Malazi, pilot at Rwanda. Currently a first officer, and my relationship with the Buta Foundation, I'm a Sigwa Awodi, and most importantly, I'm a mentor. My name is Aurora Mutesi, and I'm an academic campus director here at Kepler. My relationship with the Buta Foundation started after I finished my secondary school, and I received an award as a best performing girl in 2008. My name is Lillian. I'm a student here at Kepler, and I was awarded as a best performing girl. And the other thing is that my school fees was paid by the foundation, so I'm in the 84 generation.
My name is Advocacy. I currently serve as the permanent secretary for the Ministry of Infrastructure. And my relationship with the Buto dates back from really a long time ago. In 2004, I was awarded as one of the best performing girls for the district of Nyanza and one of the top 4 in the country.
I feel like the Buta Foundation is helping young people grow. It's giving them opportunities. So they support students to go to school. They award them, so they believe in students.
Many people don't think that the girl has started things about technology. They say, how can you like be the jumpsuit of the just for the boys? You can't go in the computer and do things like, hey, it's the mechanics is for boys that I will do it.
I'm really excited about the Buta Foundation and working with them and their philosophy of mentoring and encouraging young girls to join. Currently, we have two other Rwandan pilots, female pilots in Nigeria, and at least 4 in the police force. So that has been an improvement from the time we started working to today. And there's more training, and people wrote to me, Kemi, and tell me, oh, my little girl wants to be a pilot. And then I'm able to answer their questions and also mentor them in whatever way I can.
When I was awarded this award, for me, just gave me a boost into my confidence when it really came to also save my education. Because I was on the verge of dropping out of school, my uncle, who had been paying for my school fees before that, had just lost his job. And this award really meant for me staying in school. But also, the other thing for me, meeting the first lady on the awarding ceremony really came at the right moment, because all this time I didn't have a mother figure in my life. And when she awarded the award to me, when she gave the award to me, it really meant the world. And this time I was like, okay, so there's somebody at this level who values my hard work, who values my dedication. And for me, that really launched me into becoming the person I am today.
I give back to my work and to helping young girls who go to Kepler to improve and grow. I've also been involved in mentorship programs where I mentor other young girls. From the Foundation, it's always been powerful. You can do this, you can do whatever you put your mind to. And that's what I strive to do with different young girls in different settings. Yeah.
Before eventually doing a job or doing anything else, I needed to first give back. So I started an initiative called 100 Women who Impact Rwanda. Essentially to tell young women that
they also can do anything if they want to, if they put their minds into it, if they focus. Now, in my position today, even by the fact of being young and serving in the position I serve, I recognize that there are many other people that are inspired by this very fact. Women's achievements in gender equality and women's empowerment have been made possible by strong political will from the highest level. And this has resulted into 61.3% of women in parliament, 38% of women in senate, 50% of women as cabinet members, 48% women judges, 40% of women provincial governors, 23.3% of women district mayors, 45.2% of women district council members, and 32% of women ambassadors. It is true that women's empowerment is access to markets and can occupy decision-making roles. This leads to increased women's representation in the labor force and the improvement of children and the overall family's well-being, which in turn leads to poverty reduction and economic growth.
Thank you all for your attention.
Another round of applause for the panel. As you can see, today's panel has been special. We have 5 strong professional ladies and 1 young gentleman. I think that's a special. May I recognize the presence of the Honorable Minister of Rwanda. As you know, she is also the co-president of ITPC 2019, and without her support and leadership, we will not be here and having such a successful conference. A round of applause. We are going to have 2 award ceremonies. And the first one is for Traki. Traki is health systems, economics, and implementation staff. The award consists of a plaque and a cash prize of $1,000. And the award will be presented by the director of the council. As you all know, he's also the coordinator of the society, the custodian of the council. The title of the winning award abstract is it okay to not be okay in HIV care? Mental health resources and screening in HIV care environment in 24 districts of Zimbabwe. And I'm pleased to announce that the recipient of this award is Karen Wame. Karen is the Director for Knowledge Management and Impact Analysis for the Organization for Public Health Interventions and Development. Okay. Also, this is a local organization supporting the Ministry of Health and Healthcare in Zimbabwe to implement the National HIV Care and Treatment Program in over 700 health facilities to support for people. Karen has more than 17 years experience in HIV program design and production in Sub-Saharan Africa. She holds an NMC in public health from the London School of Hygiene and Tropical Medicine. And she's currently in her final study of the PhD. I think I'll present the award. So look, if we were trying, once we go to the Leadership Award. The Leadership Award will be presented by the SAR President and President of CASA 29. Professor, you will join you. And the recipient is Monsieur Odibo Kane. Monsieur Kane est un enseignant à la retraite. Il est au Mali et il a été élevé au rang de chevalier de l'ordre national de mérite grâce à sa contribution à la lutte contre le VIH-Sida. Il a eu des premières personnes à révéler son statut sorologique de manière publique. Part of my former is that de 1992, il a été président du réseau africain de personnes vivant avec le VIH et plusieurs fois l'ambassadeur de l'espoir. Modibo est actuellement le coordinateur national du réseau malien de personnes vivant avec le VIH. It is now my pleasure to invite the honorable minister to join us. There will be the chair and the speaker of the board. I can also see that Dr. David Maranatha is here. He was the group president for CASA 2019. He was also the minister of health for Zimbabwe. And it's my pleasure to invite David to join us. Please. Dr. David Maranatha, please come. And as you can see, I have never joined the group photographs, but today I will join the group photographs. So we have come to the end of the last plenary session, and I feel my pleasure to have served. My name is Lillian. I'm a volunteer for the study for Islam. Thank you. Please remember that the next session, which is the closing session, starts at 10:45. We will start with the rapporteur session, and then we'll have the official. So please be in your seats by 10:30. Please be in your seats so that we can receive. Thank you.